Okay, this video is how to live longer for beginners. This is part 2, and this slide right here is a really cool slide. I'll actually take myself off of it, and if you want, you can hit the print screen button, because what I'm about to show you is really profound, really interesting, good stuff. So this is from the work of James Mitchell, PhD, the professor over at Harvard, and this was from his lecture. I'll put the link to it below at the Buchinger Wilhelmi Clinic. Okay, so what he's saying is that when you eat the diet, that the best diet is high in carbohydrates, low in protein, and low in fat. Then the question is, well, why does he say that? Everybody knows that, Kempner had his patients, McDougall's diet, Esselson's diet, the Spartan vegan diet of my own, is that high carb diet and low fat is the best. But he's adding more to that. He's saying it's also low protein, like Kempner. And why does he say low protein? Because here's what he says happened in his research. That when you feed a low protein diet to the animal, there's less amino acids floating around. All right, when there's less available amino acids, the body, the liver's job, the most important thing the liver does is maintain a blood glucose level during fasting so that the brain has enough glucose. That's the most important thing the liver does. Well, it normally will take extra amino acids and it'll convert some of them into glucose. That's called gluconeogenesis, to make new glucose. However, when a person eats a low protein diet, there's just not that many amino acids available to be converted into glucose. So instead, the body has to burn fat to make glucose. Now, typical fat is in the form of what's called a triglyceride, meaning 3 fatty acids attached to a glycerol backbone. Glycerol is a 3-carbon molecule. And remember, glucose is a 6-carbon molecule. Basically, 2 glycerols stuck together pretty much makes a glucose. So what the body will do is it'll break down triglycerides in your fat tissue, and it'll take the glycerol, send it to the liver, and the liver will convert that into glucose to make sure glucose is available for the brain. On the other hand, it really doesn't need these fatty acids and doesn't have anything to do with them. So what James Mitchell is saying is that, out of good luck, I'm not sure exactly why, but his research showed that the liver tends to take those fatty acids and say, look, we don't need these right now. And they send them to bat. Bat is brown adipose tissue, and they tend to just burn them for heat. So in a sense, it's wasting them, in a sense. But the point of all this is that he's claiming that by eating a low-protein diet, you burn more fat, and it helps optimize your body weight. And in his opinion, from looking at Kempner's diet, he believed that Kempner's diet was additional proof that what's happening in animals happens in humans. And so what I'm getting at, so this is, part 1 of why low-protein diets are good. There's another reason why low-protein diets are good. When you have lower protein, you have less activation of mTOR, especially less animal protein, because there's going to be less lysine, there's going to be less methionine, less leucine, methionine, lysine, etc. Anyways, you thus will have less activation of mTOR. All right. Also, by eating low fat, you'll get less of an increase in insulin-like growth factor. That also means less activation of mTOR. So you're going to have less cell replication. That's going to help to slow down the growth of cancer. That's going to help to slow down aging because your cells don't replicate. When a cell replicates, it has to make a copy of itself. Cells got 3.3 billion DNA base pairs, so that's a lot of nucleotides it has to make. It has to make a lot of membranes, needs a lot of fat for that. It has to make a lot of proteins, needs a lot of protein for that. So you sort of want your body to, walk the line, if you will, have enough energy of all forms that it needs, to maintain high activity levels, but not so much excess sitting around that it accelerates aging or cancer growth. So anyways, that's an AO right there, an academic orgasm. That's really beautiful, clever stuff that Mitchell figured out. All right, this is just showing you what does fiber do? This is like the Dennis Burkitt work. Dietary fiber pulls water into the stool. So when you defecate, you should be popping out a cow patty. If you don't eat enough fiber, your stool's dried out, and you're sort of popping out Tootsie Rolls. The problem with dried out stool, like say in the right side of the colon, is you'll form stool balls, little rocks of stool, called fecalith. Feces, fecalith. Lith means stone. Appendicolith is to form a stone in the appendix. That can block it off. The mucus glands keep secreting. Appendix pops. That's appendicitis. Back pressure from straining at the stool during defecation will cause diverticulosis, little outpouchings, bulges in the wall of the sigmoid colon. One of those pops, that's diverticulitis. The pouch itself is diverticulosis. When it pops, that's diverticulitis. Itis means inflammation. Why do you strain at the stool? Because normally when the stool is wet, it's sort of more bulky and it bulges out the side walls of the colon. So when the stool is wet, it bulges out the side walls of the colon, and that causes a reflex to contract, so you defecate. You remember, if you're a normal plant eater, defecating is like almost effortless. It just goes, you ready? Yes, open up the lower sphincter, it just pops out. All right, but somebody who's constipated, because it's not distending the walls of the rectum, they don't get that reflex contraction. So they're tightening up their abdominal muscles to help pop out the stool, and there's like, they can't get that last little bit out. There's an incomplete sense of defecation, so they're kind of straining to pop out that last little Tootsie Roll. And that constant back pressure every day or so causes back pressure on the stomach. Part of it will have a tendency to gradually make the the diaphragmatic hiatus for the esophagus a little bigger, and the esophagus starts to pop into the chest. When part of the stomach pops in the chest, it's called hiatal hernia. You'll tend to reflux acid from the stomach in there. That's called gastroesophageal reflux, GERD. Gastroesophageal reflux disease causes inflammation of the esophageal wall right there. It's called Barrett's esophagus, increases your risk of esophageal cancer. The straining in the back pressure will cause varicose veins in the legs, dilated veins in the scrotum, varicocele, so it can heat up the testicles, cause infertility. So yes, constipation can make you infertile. It also increases your risk of popping out hernias, inguinal hernias down here in the groin area. Same diets associated with gallstones and other problems. This is abdominal pressure syndrome, as figured out by Dennis Burkitt, the Irish Christian missionary. Okay, the lack of dietary stool is also a problem for causing leaky gut. Fibers used by the good gut bacteria to make short-chain fatty acids. Most important one's butyrate. Butyrate goes into the intestinal lining cells. It's a single layer thick, and it's used to make TJs, tight junctions. These are tight junctions that prevent anything bad from getting across your gut wall. If you don't have enough dietary fiber, or you have exposure to these chemicals here, you can get leaky gut, meaning increased intestinal permeability. Now bad stuff gets across that gut wall. The classic thing is LPS, lipopolysaccharide from bad bacteria, gram-negative bacteria. There's also something called LTA, lipoteichoic acid, from gram-positive bacteria. That gets across the gut wall, and it can cause inflammation in your gut, irritable bowel syndrome, full-blown inflammatory bowel disease like ulcerative colitis, Crohn's disease. You'll also absorb big chunks of proteins, and they can confuse your immune system, which will form antibodies to them. And because it's come from an animal protein with an amino acid sequence somewhat similar to our own, those antibodies can cross-react with our own body. That's autoimmune disease. That's the main mechanism of autoimmune disease. It's called molecular mimicry, because the amino acid sequence is similar to our own from a mammal, the protein, with autoantibody, auto against ourselves, cross-reactivity, meaning that you eat a hot dog, which is like throwing an animal in a blender. There'll be some thyroid tissue in there. Will form antibodies to their thyroid tissue, and then the antibodies formed to the animal thyroid tissue might cross-react with the person's own thyroid tissue and cause Hashimoto's disease, autoimmune thyroiditis, and that will lead to hypothyroidism, which a lot of people have, especially women. About 80% of autoimmune diseases are in women. Okay, the other thing is, by getting that leaky gut, you'll get these endotoxins, LPS, LTA, going across the gut wall. Excessive iron, which also is characteristic of meat diets, and also fortified processed foods with iron. Those will cause abnormal clotting. They cause an amyloid transition from alpha helix secondary protein structure being like a slinky to becoming flat like a deck of cards. Beta pleated sheet it's called. And the bottom line is they cause a lot of clotting, refractory clotting. These little clots can travel to parts of your body, plug up small arteries in your brain and other parts of your body and your heart, microvascular angina. It's bad. Okay, we're not going to get into this in any more detail, but if you're curious about it, I've got other lectures on it. Amyloid clotting, amyloidogenic clotting. It's the research work largely of Douglas Kell from England, Atheresia praetoris from South Africa. They deserve a Nobel Prize, but they'll never get it, even though they deserve it. A lot of great scientists don't ever get the prize they deserve. Okay, so I basically said, Van Gogh, cut his ear off because he was crazy, but most Americans, they make themselves sick just because they're ignoramuses and they don't eat healthy. And it's a futility cycle. Conventional medicine, the doctors aren't trained in what I call NETs, nutrition, epidemiology, toxicology, and then the S's are things like stress reduction, spirituality, sleep, etc. But basically, they don't know what causes disease, so they don't know how to cure it. They're trained with medical textbooks that are a joke. The basic conventional medical textbooks, they try to say that most problems are due to aging, genetics, infections, and then socioeconomic factors, which is all BS, because what they're basically saying is there's nothing you could do. It's just, shit happens, and you guys take our drug and go for surgery. This is also called a lamplight fallacy, whereby the person, the drunk who lost their keys, just looks under the lamplight. Somebody walking by says, "Oh, did you lose your keys over here?" They say, "No, I lost them over there." They go, "Well, why don't you look over there?" He goes, "Oh, there's no light over there." And what I'm trying to say is, they only look for this type of stuff, and that's why they never find anything useful. The real answers are over in nutrition, epidemiology, toxicology, all this lifestyle stuff. And that's why you can't rely on conventional medicine to help you cure chronic disease, diabetes, hypertension, obesity, coronary artery disease, atherosclerosis, etc., because they don't know what to do. The pre-med, med school, residency education, they've left out the most important things. They study all this nonsense like physics. Physics is nonsense to a doctor, okay? Other than some really rare esoteric stuff, it's irrelevant, okay? I'm a triple boarded, high-tech doctor. I never use any math I didn't know by 4th grade. Internal medicine foundation of science is like the caterpillar in Alice in Wonderland blowing smoke. It's a joke, okay? And what happens to doctors, they're all, whipped with a carrot and the stick. The carrot and the stick is basically, the carrot is keep your mouth shut, generate billing codes, and you'll make a little money. And you can spend it on your family and I'll get out of here, okay? And then the whip is, we don't want you wasting any time doing anything else because that does not make money for us. If you want to talk about, vegetarian diet or some other BS like that, do it on your own time after hours, all right? So every hospital in the Western world has a bean counter that tracks the number of billing codes generated by each doctor every day. And the doctor has to generate the same amount as the other doctors in their group, or otherwise they'll get in trouble for being quote-unquote unproductive, implied lazy. So if some internal medicine doctor sits there and starts talking to you about the vegan diet and starch and stuff, they will not be able to see as many patients per day as somebody else who just matches the ill to the pill and sends a bill. So that's why this is never going to change. Conventional medicine could never change because the people who run it are making billions of dollars. They want to keep making their billions of dollars. They don't give a rat's butt about the patient. The patients don't matter. All that matters is generate the billing code and provide the standard of care, because if they provide that standard of care, they get paid. They can't be sued no matter what happens to the patient. The patient's outcome is considered irrelevant. So that's what they're going to do. And the system can't change because it's too profitable. It's too big to change, all right? So forget about that. Only the individual can learn their way around it. The scientific foundation of clinical medicine for chronic disease is nothing but a pack of cards. It's a joke. It really and truly is an absolute joke. Doctors don't know nutrition, epidemiology, toxicology, and it's actually getting worse. It's not getting better. With high-tech electronics, you can build a better CAT scanner, but the foundation, the moral foundation, the ethical foundation, the clinical foundation of medicine is getting worse and worse each year. In 2023, over 10,000 research papers were retracted. If you go back in time 20-something years, it'd be like maybe 100 or something. Now it's 10,000 times, 2 orders of magnitude more. Okay, 3 orders of magnitude. And there's no hope in sight that it's going to improve because there's no money in improvement, real improvement. Money comes from lying and selling drugs, not from actually helping people. And so that's why I joke. If you just take somebody with the education of a health coach, they spend a month watching nutrition and health videos, they can know more than the chief of internal medicine at Harvard. The chief of internal medicine at an Ivy League school, they have to go on drug base because they need to get grant money from the drug companies or from the device manufacturers. Otherwise, they can't get grant money to do research. If they don't generate publications, they can't keep their positions or get promoted. So it's always going to be the way it is. It will never fix itself in our lifetimes because there's no incentive to fix it. And that's why the papers that come out of these fancy name places, including these Ivy League places, most of them are a joke. So here's like the Harvard School of Public Health. So you would think, oh, the best place, it should be great. No, it's a joke. Like I said, I would flunk a student if they put this in there that olive oil is a foundation of the diet. That's insane. It's totally stupid. Recommending all this meat, all this soy, all this alcohol, multivitamins, dairy. It's just cheese. Stupid. It's completely wrong. Why would they do something like this? Oh, I'm sure industry influence has nothing to do with it. You don't have to be a genius. Just look at all these healthy populations. In the words of Dr. McDougall, all large, healthy populations eat a starch-based diet. There are no exceptions since the beginning of recorded history. Papua New Guinea eat 93% of their calories from sweet potatoes. The Chinese eating tons and tons of rice. The Japanese also eating tons of rice and vegetables. The Kenyans eating plant foods, okay, lots of corn. The Tarahumara in northern Mexico, Sierra Madre, Copper Canyon area, eating lots of corn, squash, and some beans. These guys can run 100 miles in 2 days. The Kenyans win most of the marathons and long distance races. Kipchoge just ran a marathon in less than 2 hours, world record. Okay, I've talked about all the poisons in processed food. I'm not going to go into that because we've gone into that in so many of my other lectures, but the bottom line is you don't want to eat processed food. It's full of toxic chemicals as well as obesogens, things to make you fat. None of those are going to help you live longer. I said it before too, if you learn this, nutrition, epidemiology, toxicology, you become like a Gulliver for being able to improve health and treat the chronic diseases. And if you don't know it, then you're just a Lilliputian. And the medical system is an intentional Lilliputian because a doctor who learns more than that will not be rewarded for it in the conventional system. And like I said, we already know what works. You just set up an outpatient clinic like the Rice Houses for Kempner in North Carolina, Durham at Duke, McDougall's telehealth clinic, etc. Pritikin did the same thing, and others have done the same thing with great success. And you just teach people how to eat correctly, and then you teach them a little more than that, avoid toxins, and you can get incredibly good results. Okay, here's just some more of this epidemiology. The Tarahumara and the Pima were basically about the same population in northern Mexico. Mexican-American War separated them, with the Pima pulled into Arizona after 1848. They've now eaten the standard American diet. They're all fat and sick in general. Tarahumara kept their old ways. They can run 100 miles in 2 days. So here's just showing a Tarahumara runner versus the Pima just get the same diseases as anybody else eating the standard American diet, or even worse. Okay, here's a sea squirt. As a juvenile baby, it's like a tadpole, swims around, has a brain. As an adult, it attaches to a rock, becomes a filter feeder. Its brain reabsorbs. You don't need a brain if you just sit on the couch watching TV. So diet's, 75% of health, but the other stuff matters too. Get your exercise, manage your stress, get your sunshine, get your sleep. Yanomamo in Amazon jungle at the junction of Brazil and Venezuela, they don't get any high blood pressure. They don't add salt to their food. They just eat a primarily plant-based diet. In America, blacks have hypertension off the charts. Walk into any dialysis unit, you'll see a bunch of blacks all on dialysis because they've trashed their kidneys from hypertension. All right. The Donison paper, 1929, Lancet Journal, 1,800 consecutive admissions. There was nobody that was hypertensive. Nobody. In Kenya, where they ate a plant-based diet, the average blood pressure in their 60s is 110/70. Okay, in America, the majority of people are hypertensive. Okay, here's South Africa, the Bantu women. Average ones having about 9 or 10 kids, nursing them 2 or 3 years. They get hardly any calcium, about as much as you have in one little cup of milk. They don't have any problem with osteoporosis. Calcium's not the key issue in osteoporosis. All right, and they're giving lots of their calcium away to their babies, nursing them so much. So, people need to exercise and eat plant diets. It's the acidity from the meat foods that predisposes to osteoporosis. Primarily, that's the problem. Okay, the Okinawans, when they ate, they're like Hawaii is to America. That's like Okinawa is to Japan. When they ate a plant-based diet with a lot of sweet potatoes, they're living really long and healthy, longest out of any of the Japanese, with the average woman 86 years of life and the average man 78 years of life. That's pretty good. They walk a lot. They have tight-knit communities, good friendships. They're ikigai and all that stuff about having a purpose and close social support system. The Japanese, their health starts going down when they go to Hawaii. When they become further westernized, going to California, their health just keeps dropping and dropping. Longest lived, well-documented population was the vegans of the Seventh-day Adventists, with the women living about 88.6 years, the men about 85.3 years. That's the longest recorded, well-documented lives of any population. And people could probably live longer than that. McDougall worked with that population, and he said a lot of them weren't the healthiest vegans, that if they avoided oils and a few other things, they could live significantly longer. So there's reason to be optimistic that a person could probably live into, let's say, their mid-90s if they optimize all their health parameters. Okay, maybe longer than that as well. In Finland, they had really poor health, very poor longevity. And then Pekka Puska was a doctor who was given the task of trying to improve health in Finland, and he got them to reduce their intake of animal foods, to reduce their salt intake, taught their wives how to cook for them. And they had an 84% drop in cardiovascular mortality in Finland. That's incredible. It's also been looked at, by Roy Swank and others, World War II rationing, World War I rationing as well. Because of rationing, they ate less animal foods, the health was dramatically improved. Okay, and it was more important, the diet, than was the psychological stress associated with those difficult times. Okay, so that's the end of part 2 of how to live longer for beginners.